Very good morning, Mr. Raghuvanshi. And firstly, congratulations on a strong set for FY26. But help us understand when we see our numbers, it's the revenue, margins, and PAT. They have all shown the double-digit growth. But what were the key operational levers that helped you post a 43% jump in EBITDA and like 53% jump in the profits?
So we have maintained the momentum which we have been having for last few quarters, and this quarter, essentially the occupancy numbers went up, which was about 69%, and also our number of occupied beds increased by about 6 to 7%. So these two levers, along with the higher RPOB, drove the better performance.
Right, and Dr. Raghuvanshi also help us understand, is this level of margin expansion sustainable as we move through the year?
Expect this momentum to continue. We had earlier commented that every year we expect about 2 to 3% of EBITDA increase, and that momentum we expect to continue this year as well. And that would come on the backing of a better occupancy. We expect the occupancy to become better than this. And at the same time, we are commissioning more beds. 900 beds we are adding this year. Out of that, about 50% we will commission within this financial year.
All right, but specifically when it comes to the occupancy levels, they have now risen to 69% and even a good growth in the RPOB as well. But what kind of an occupancy range are you targeting for the full year FY26, since you were just highlighting that new beds will get added and half of them will be commissioned this year? And is there further headroom to drive the RPOB growth, especially with the higher paying procedures or international patient volumes?
Yes. So as far as occupancy is concerned, we expect it to be around 72% this year. And as far as ARPOB is concerned, I think that will get moderated a little bit as we go further because it is primarily driven by the case mix change. So definitely we would focus on quaternary kind of care. So we are doing large number of robotic procedures across our network, and we are doing a larger share of oncology business. So these are basically driving the RPOB. And that trend will continue. However, I expect the RPOB growth to be slightly more moderate as we go further in the financial year.
Sure, sounding optimistic on that occupancy figure, Dr. Raghuvanshi, but let's talk about your international revenues. They've grown 21% in the quarter gone by. Help us understand what's driving this uptick. Is it geography specific or is it linked to specific specialties within those areas?
Yeah, it is more of a geographic spread which we have. There has been some challenges on the international business because of the geopolitical situation, etc. We have seen that some of the countries, the numbers have come down. For example, Bangladesh. In the interim period, we also saw that the traffic from Middle East also came down. We used to get a lot of patients from Iraq, etc., which came down. However, the traffic from Africa and other Central Asian countries is still good. And I think that will keep on building the momentum on the international patient side.
All right, but you have added the beds and the recently signed agreement as well. But can you elaborate on how these additions and the asset-light expansions will impact your growth and the returns over the next few quarters?
So Gleneagles is part of the IHH portfolio. And we are going to be managing, in the first phase, we are managing 5 of their hospitals with about 700 beds. But this, we will not be consolidating the revenue. We would be getting O&M fee, which would be 3% of their top line. So it will be accretive to our bottom line.
Sure. Okay. Sounding optimistic over there. But Dr. Raghuvanshi, let's talk about your diagnostics business. And the EBITDA margin in that segment has been quite impressive this time around. It's jumped to 23% from 16%. one last year. Even if you exclude the one-off that we've seen, the margin improvement is still quite impressive. Help us understand what's driving this turnaround. Could it be scale, pricing, product mix, and how do you plan to sustain this margin trajectory going ahead?
Yeah, so in our diagnostic business, we had certain challenges, especially because when we changed our brand, it was a very abrupt change. From SRL, we changed to Agilus, and that process was abrupt, and that did affect the business in a significant manner. However, now after the new brand has been established, and we have made certain changes in terms of the rationalization of our lab network, etc. All those things have led to this growth. So at the same time, we have also acquired the SRL brand also through a court process. We are able to establish the heritage of this business better. So the consumers do recognize this business differently now. With that, along with the operational efficiencies, we expect this margin to expand further. And at the same time, we have also seen reasonably good growth compared to the industry. We have had about 5% growth, which is in volume terms. And some growth in the expansion of the average realization per test. So both these things have led to a significant 7-8% growth, but we expect that to go to double digits in the coming quarters.
Raghuvanshi, we do understand that you are on the expansion spree, but along with that, we do see that your net debt that has increased to over 1,800 crores, with net debt to EBITDA now close to that 1 time. But could you walk us through the reasons behind the rise in the leverage, and what's the strategy ahead? Are we likely to see further debt funded expansions?
Yeah, so we currently are not anticipating any increase in debt. Our current situation is also very comfortable. Our debt to EBITDA ratio is about 0.93, which is very healthy. The reasons why our debt position increased is one, we had acquired 31% of the PE stake from in Agilus business last year. And the other expenses which we made was the brand acquisition of Fortis Healthcare as well as the SRL brand. So all these things together have led to this slightly increase in the debt position. However, we believe that debt to EBITDA ratio of 0.93 is a very healthy number. For all the other expansions which we are doing, that is being funded primarily through internal accruals, and we don't expect the debt levels to go up significantly. It may go up a little bit during this year, but then we expect it to come down from next year.
And lastly, before we let you go, Dr. Raghuvanshi, just give us a slight bit of an outlook with respect to your recent acquisitions and new O&M partnerships. Help us understand what kind of synergies or revenue visibility are you building in for FY26 and beyond?
Yes, so we expect a lot of synergies with our Gleneagle O&M contract. We are looking at synergies on the supply chain side, on the clinician collaboration, etc. And it also gives us a further larger scale. So all those factors are going to be helpful. But as far as our revenue growth is concerned, as on the diagnostic side, we are expecting, as I said earlier, about 10% growth, and we expect about 15 to 16% growth on the hospital side.
All right, with this, Dr. Raghuvanshi, we let you go, and thank you so much for taking the time out and speaking with us. So that was the management of Fortis.